So welcome to the next episode of the Explain series, and this is going to be a question and answer session on circumcision. Does it affect sperm production or overall fertility? So if you have a circumcision, and there are risks obviously to any kind of circumcision, and they are, that is bleeding, infection, pain, and obviously reoccurring balanitis or reoccurring phimosis, especially if the circumcision was only partial. That's why many urologists won't do partial, especially if it's for phimosis, balanitis. They'll do a total or a complete circumcision. But you can obviously have a little bit of pain afterwards, and if it gets infected, that can be a very, very nasty infection. And so hygiene after the operation has to be absolutely immaculate, and obviously there's also a little bit of bleeding. These are the risks of operation. But if you get those problems of an infection, then obviously you're not going to necessarily feel very sexual afterwards, especially if you've got pain. And so those indirectly can affect fertility, because if you get pain when you have an erection, you won't want to actually complete sex. So it doesn't actually affect your ability to produce sperm, and it doesn't affect the viability of those sperm if you have a circumcision, or if you are remained uncircumcised. So no, it doesn't affect overall production.